Marfan syndrome is an autosomal dominant connective tissue disorder. In about 3 out of 4 cases, the gene is inherited from a parent who is affected. A child of an affected parent has a 1 in 2 chance of having the syndrome. In about 1 of 4 cases, the abnormal gene is from a new mutation. This is typically caused by mutations in the FBN1 gene and affects the skeletal, cardiovascular, and ocular systems. The estimated prevalence of Marfan syndrome is a 2 to 3 in 10,000, although these numbers may be underdiagnosed. Patients with Marfan syndrome are usually thin and tall, with overall large extremities. Although some patients may not be taller compared to the rest of the world, they're usually taller than their family members. It is of utmost importance to evaluate the patient thoroughly. Early diagnosis is of crucial importance in Marfan syndrome due to life-threatening complications from the disease, such as cardiac and vascular pathology. Marfan syndrome is diagnosed by using the revised version of the Ghent criteria. The ocular manifestations of Marfan syndrome include bilateral ectopia lentis, early myopia, retinal detachment, flat cornea, increased axial length, hypoplastic iris, and ciliary muscle hypoplasia. There is an increasing number of studies evaluating the eyes of patients with Marfan syndrome, focusing in the cornea, considering it a screening tool. In Oftalmosalud, we work in partnership with a national association of patients with rare diseases, including Marfan syndrome, so we can evaluate, run the proper ophthalmic tests, and surgically correct any possible ocular abnormalities in order to give our patients the best of the possible benefits. Thanks to this, we've been able to start a database. Based in 120 eyes, we have found that the central corneal thickness was 559 microns. We would think that in patients with collagen abnormalities, the corneas would be steeper. But according to different studies and our investigations, the corneas are flatter compared with the rest of the population. It is also described that the corneal biomechanics are different. The corneal resistance factor was decreased to 9.23 and corneal hysteresis to 8.89. 13% of the patients had retinal detachment in their first visit. One of the major criteria for Marfan syndrome diagnosis is Ectopia lentis. In our clinic, 79.6% of our patients' eyes had lens subluxation. No lens abnormalities were seen in 17.8%, 1.9% were pseudophakic, and 3.7% were aphakic. It is well known that we find the lens mainly subluxated supratemporal, but in our series of cases, we found that the lens was subluxated supranasal in up to 37% of the patients. We decided to use the aid of an endoscope to have a clearer view of the zonular laxitude. We found that there are areas clear of zonules, and what we believe, that there are iris particles within the zonules. We proceeded afterwards to start the lensectomy and lens implantation. Accessory and main incision are created, followed by intracameral injection of anesthesia. Dispersive and cohesive viscoelastic is placed in the anterior chamber. Continuous curvilinear capsulorhexis with caution is performed due to weak zonules and lens instability. Another useful way to do the rhexis is with the help of radiofrequency, making the problem of weak zonules easier to solve. We proceed with hydrodissection and hydrodelineation. Bimanual irrigation aspiration is performed. Then, vitrectomy with capsular lysis and pupil reformation. Wound enlargement is done. A retropupillary lens is injected. and the aptics are fixed to the iris. With this lens implantation technique, we have not had complete lens subluxation and only 2 patients with 1 aptic subluxation. They were promptly repaired. We can also change the lens if needed in an easier fashion. And then, we inject intracameral antibiotics and close the wounds. In conclusion, the child of an affected parent has a 1 in 2 chance of having the syndrome. Genetic, cardiovascular, and orthopedic consultation should be done. Retinal detachment is a threat that should be investigated periodically. Flat corneas are characteristic of this pathology. The biomechanics are different from patients with no known diseases. More studies are underway. In our series, supranasal subluxation was more common. Radiofrequency can be of great help in difficult cases. It is easier to insert and clip a retropupillary lens, also making it easier to change if needed.